So thank you all for joining us at the Irish launch of the Lancet Countdown Report 2021. My name is Dr. Saib Lee. I'm an obstetrics and gynecology doctor working in Dublin. And the event today is co-hosted by two organisations that I have the privilege of working with, the Irish Global Health Network and Irish Doctors for the Environment. And these two organisations are actively and passionately involved in promoting the links between our changing environment and human health, and how this is affecting us all on a global scale. So our event today is entitled Climate Change, Implications for Health and the Healthcare System. The 2021 Lancet Countdown report, which was published last month, declared a code red for a healthy future. It warned us of an unabated rise in the health impacts of climate change, increased heatwave exposure, increased suitability for the transmission of infectious diseases, and threats to food and water security, all of which are overburdening the most vulnerable populations. These changes are also taking place in the context of the COVID-19 pandemic, a global healthcare crisis that has claimed the lives of millions and resulted in a worldwide economic recession. While global emissions fell in 2020, the economic recovery from the pandemic is predicted to lead to an unprecedented 5% increase in greenhouse gas emissions in 2021. However, the Lancet Countdown recognises this as an opportunity. If we can direct the funds allocated to the COVID-19 recovery towards WHO's prescription for a healthy green recovery, we can deliver a future of improved health, reduced inequity, and economic and environmental sustainability for all. We meet today 1 week after the COP26 meetings in Glasgow, declared by many to be the most exclusionary COP ever. The final document, the Glasgow Climate Path, has set us on a path of an estimated 2.4 degrees of warming, far higher than what scientists have advised of 1.5 degrees. However, despite the fact that it's not as ambitious as many of us had hoped, experts and activists worldwide are advocating against despair and instead for sustained pressure and action. Healthcare workers and the healthcare system have a unique role to play in the climate crisis through treating patients suffering from the effects of climate change, reducing the emissions of our sector, and using our voices as advocates. Today, we are going to hear from a fantastic lineup of speakers on how healthcare can mitigate and adapt to the climate crisis, what the outcome of COP26 means for us, and where we as healthcare workers and as humans can go from here. Our first speaker today is Dr. Jodie Sherman, one of the authors of the Lancet Countdown report. She's joining us to launch the report, speaking specifically on the indicator 3.6, healthcare mitigation. Dr. Sherman is an Associate Professor of Anesthesiology at the Yale School of Medicine, Associate Professor of Epidemiology in Environmental Health Sciences, and faculty in the Yale Center for Climate Change and Health in the Yale School of Public Health. Dr. Sherman is the founding director of the Yale Program on Healthcare Environmental Sustainability and the Medical Director of Sustainability for Yale New Haven Health. She's a member of the Lancet Countdown on Health and Climate Change and was a contributing analyst for the UK NHS Net Zero Carbon Plan for developing long-term strategies and implementation plans for healthcare supply chain decarbonisation. After Dr. Sherman, we're going to hear from Helen Maher. Helen is an estates manager in the HSE Climate Action and Sustainability Office, or CASO. CASO's focus is health service energy efficiency, waste reduction, water conservation, and sustainable transport. CASO procures development of sustainable health service buildings from design to operation and promotes green public procurement in all aspects of the health sector. We're then going to hear from Colin O'Hare from the Department of Health here. He joined that department in 2021 and heads up the Climate Change Unit, which seeks to align climate action across the health sector with national efforts to tackle the climate challenge. Colin previously worked in the Department of Environment, Climate and Communications, where, as Ireland's focal point to the UNFCCC from 2016 to 2019, he supported EU and global climate action under the Paris Agreement. Our final speaker of the day will be Dr. Terry Kemper. Dr. Kemper has roots in Tuam, County Galway, but is a retired GP from England. He is the Royal College of GPs National Representative from Sustainability, Climate Change and Green Issues since 2017, and co-chair of the RCGP Climate Emergency Advisory Group. He is an executive member of the UK Health Alliance on Climate Change and a national representative for greener practice. He is also the current lead for the RCGP Green Impact for Health Toolkit alongside NUS and SOS. So I'm going to hand you over to Dr. Sherman to get us going today. And at any stage throughout the morning, if anyone has any questions, you can post them in the chat.
Well, thank you, Dr. Lee. And are you seeing just my slides or my entire screen?
See your entire screen there at the moment.
Okay, let me just re-click on this. Bear with me. You don't want to see all that. Okay, that looks better. Well, thank you for this opportunity to present at this really important event. I'm sure everyone here is aware of that healthcare is a very resource-intensive endeavor. Hospitals run 24/7, they're high-tech diagnostic equipment, therapeutic equipment, high energy intensity buildings, more than 2 times other similar size commercial buildings. We also have something unique about healthcare, and that is our infection risk prevention requirements. We also work in a regulatory complex environment, and there are business models that drive low value consumption of resources, particularly single-use disposable items. We also, I will speak for myself in the US, I can't speak to Ireland, but we certainly have a culture of excess. Being in a high income nation, disposability is normalized. It's really not normal to throw things away. In nature, there is no such thing as waste. What waste is a product for another system. But disposability and waste is normalized, and particularly in healthcare. And our social mission, we feel good about taking care of our individual patients, but we've been really ignoring what we're doing to public health through that care, and we can't really do that any longer. And so the most updated findings of the Lancet Countdown demonstrate that globally healthcare emits 4.9% of total global greenhouse gas emissions. This is the most recent. There have been a few international studies in recent years. Healthcare emissions globally are rising at a rate of between 5 and 6% annually. It's going up. Healthcare is enormous. It's 10% of the global economy. It also presents opportunities for us to not only shift our own sector, but it intersects with so many other sectors, which is part of why trying to shift healthcare is really important. And I will say, US healthcare, we're number 1 and not in a good way. We have the highest per capita greenhouse gas emissions of any nation, bordering 1,800 kilograms of CO2 emissions per capita for healthcare expenditures. And Ireland is about 900 kilograms. So Ireland is buried somewhere in here, so similar to Great Britain. But, it's not just how much per capita. If we have the, better healthcare access and quality for those dollars spent and those emissions, there could be some argument that it's the right thing to do until we figure out better ways of producing and using our materials and taking care of patients if we have better health outcomes. So what we did with the Lancet Commission, as well as we associated those per capita healthcare greenhouse gas emissions along with the global burden of disease from the Institute of Healthcare Metrics and Project, has a healthcare access and quality index. This was from the 2020 report. In 2021, the one that just came out, we did something similar, but instead of using healthcare access and quality, we used the development index from the World Wildlife Federation. And so similar results that, the more greenhouse gas emissions, obviously the worse our performance, but the higher we perform on development, the higher we perform in healthcare access and quality, the better. So you want to be, to the left on the x-axis, and to the top on the y-axis. So all these green dots are European countries, and Ireland's in here as well. Actually, Ireland's again is over here somewhere. And the USA is an outlier again, so per capita greenhouse gas emissions and healthcare access and quality. But what this shows is that, at least in the case of the US, is that there are better performing healthcare systems than the US. And even in terms of Ireland, there are better performing. In fact, France is an exemplar here because we did a break-even analysis and found that after about 450 kilograms per capita of healthcare greenhouse gas emissions. There's no improvement to healthcare access and quality. What that means is that we can reduce emissions without compromising healthcare quality and access, and in fact, use that money to improve our quality and access of care. That's really important because globally, 1/4 of healthcare services are deemed inappropriate or low value. This is true in both high income and low income nations. And so you may be familiar with this. This is from one of the beautiful images from the UK NHS net zero report. Basically, this is applying the greenhouse gas inventory protocol, which is an accounting tool of where the emissions are coming from in healthcare or in any sector. And it's important to know that so we know where the levers of mitigation lie. So scope 1, those things directly coming from a facility, including the fuels burned to heat the indoor space. Inhaled anesthetics are released off the hospital rooftop, so those are a direct emission. Indirect purchase of electricity, and then scope 3 is pretty much everything else. So the supply chain, travel, so the difference between direct and indirect emissions. It's important to understand the levers of action. And so this is from the Tennyson publication, which is a scientific study of the work of the NHS. And you're probably familiar with this diagram. Importantly, 2/3 of the emissions are coming from the supply chain. The notable chunks of that coming from pharmaceuticals and chemicals, medical devices and supplies, and food consumed in healthcare, both by patients and staff alike. And of course, inhaled anesthetic gases and metered dose inhalers are part of this big outlier. And what that is important to point out here, why that's important, is because clinicians, healthcare administrators, regulators, we control the consumption, the demand and appropriate use of those resources. Manufacturers and regulators control what's embodied in emissions that go to marketplace. And so we have the ability to affect our direct care and also to leverage our voice and purchasing power indirectly with regulators and with suppliers. And so this is just to point out, this is from our US study of our health sector, looking at not only greenhouse gas emissions, but non-greenhouse gas emissions. We're talking about the climate emergence here, but it's not the only type of pollution of concern. We just want to make sure we don't forget that. This shows the breakdown in national health expenditures, where those emissions are coming from in the different categories. And importantly, the amount of emissions, which was translated by us into disease burden. This is from the US. We hope to do this the next iteration of the Lancet Countdown. But what this showed, importantly, the disease burden from US healthcare pollution, 388,000 disability adjusted life years. Most of that is from particulate matter, and both particulate matter and greenhouse gas emissions both stem from fossil fuel combustion. So the solutions are the same, and that's to shift to cleaner energy. This is similar in magnitude to the 44,000 to 98,000 deaths due to medical errors first reported by the Institute of Medicine in 2000 that sparked the patient safety movement. The actuaries tell us about 10 years of life are lost for each of these deaths. And if you multiply by 10, you see we're in the same order of magnitude. Why this is important is that this helps us frame to the healthcare community that pollution prevention is just as important as the patient safety movement. And so ultimately the question is, what is best practice both for patients and for public health? That's really what we're all about. We put together what we are calling the Planetary Healthcare Framework, the 3 levers of action as clinicians, and 3 streams of action: reducing emissions embodied within healthcare services. Some of that means using our voices for better policies and better materials, matching supply with demand, meaning that we are using our resources appropriately. We are not undertreating, we are not overtreating, and reducing demand for healthcare. And that means doing proper preventive services and enhancing expenditures for primary preventive care. And ultimately what we mean by value is the best outcomes for patients and populations at the least cost, least social harm, and least environmental harm. Thank you very much for your time.
Brilliant, Dr. Sherman, thank you very much. We're going to hand over to Colin next, if that's all right, Colin, due to some technical issues on our side. So we might go ahead there.
Yeah, no problem at all. I think that'll probably segue quite well anyway, in terms of taking it from the national picture more directly to Ireland's Health Service Executive. So hopefully everybody can hear me, and with a bit of luck in a minute, you'll be able to see my slides. There we go. So can we see this?
Yeah, we can see it.
Great stuff. Okay, so as I've said, my name is Colin O'Hare. I'm in the Department of Health, and what I propose to talk about here is how Ireland as a country has scaled up its climate ambitions and where the health sector fits within that picture. So I'm not going to spend too long talking about where Ireland's climate ambitions began in 2014, which was a relatively low place compared to where they're at now, but I guess that's something that you can kind of see echoed globally in terms of where the world was at pre-Paris and post-Paris and where we're at now. The key milestones were that we started off with a national policy position, which I guess was better than nothing. That was improved, built upon by the Climate Act in 2015. Then that put in place the structures which were designed to drive action in Ireland, which were on the mitigation side or dealing with the sources of emissions through the national mitigation plans, and through on the adaptation side, a framework which would enable all the sectors which have to deal with the impacts of climate change to take that forward. We pretty much doubled our climate ambition in 2019, where we replaced the national mitigation plan structure with a whole of government climate action plan structure. And then there was, in 2020, there was an appendix to that, if you like, of additional actions. COVID kind of impacted on the ability to bring out an annual plan. Then this year, I suppose the key developments we've had since are the revision of the Climate Act, which put in place, I'll talk a little bit more about what that brought. And then most recently, last month, we brought out our new Climate Action Plan 2021. So this is a bit of a snapshot of Ireland's emissions as we've reported to the UNFCCC or since 1990, which is the milestone that's used globally. I suppose the key points that I don't propose to get into too much detail here, aside from to point out, I guess, that heavy industry in Ireland is relatively low. It's somewhere in the region of 20%, whereas in most EU countries, it's around 40% of emissions. So that's something that we deal with a slightly different picture of where Ireland's emissions come from. The other key events you can see there, I suppose, the rising of emissions during the Celtic Tiger years, where we didn't really decouple emission or economic growth from emissions. Then you can see the economic downturn around 2007-08, and that resulted in, I suppose, particularly when the construction sector kind of died a death, the emissions pretty much, they dropped down, but not in a planned or a sustainable way. And then they started to go back up again then through 2015-16. And more recently then, as our climate ambition has gone up, you started to see a turn in the direction they need to go, although not nearly at the kind of steepness of curve we'd be looking for. So the Climate Action Plan that came out last month, the key things that are coming out of that: Ireland as a country is going to reduce our emissions by 50% by 2030 compared with 2018 levels. We're aiming for climate neutrality at the latest as a country by 2050. The plan doubles the ambition of the 2019 Climate Action Plan, and it sets out actions and targets across the sectors of power generation, transport, buildings, industry, agriculture, and what's called LULUCF. I can come back to that if we need to. It's a little bit technical. It's a UNFCCC thing. So what are we going to do and how are we going to get there? In 2018, we had a plan to try and reduce our the emissions associated with power generation by 10 megatons of CO2 equivalent. In 2018, we had 10 megatons of CO2 equivalent coming from power gen. The Climate Action Plan in 2019 aims to pretty much half that, and now we're going to try and reduce it by about 3/4. The target's actually 80% for 2030 in power generation, and that's probably going to be one of the most key moves we can make. If all the power we have as a country is coming from renewable sources, and if we can electrify, as we're going to come to now in a second, the likes of transport and some of the other key sectors, that'll go a long way towards helping us achieve our emission objectives. The transport sector, Ireland as a country has a very dispersed rural population, and we have a certain amount of challenges in terms of what we can do about transport emissions, but our plan had been to take them down from the 12 megatons in 2018 to I suppose 2/3 of that in the 2019 plan, and now to roughly half of it in the 2021 plan. On the building side, the biggest challenge we have, again, I suppose by the nature of having dispersed population living in detached houses spread across the country, is trying to manage to retrofit those buildings to an extent that the amount of power required to heat them and do everything else you want to do can be significantly reduced. So the carbon footprint from that in 2018 was 9 megatons. And in 2019, we aimed to reduce that down to about 5 or 6. And now we're aiming to reduce it to 4 or 5. Like I said, our industry sector isn't quite as big in terms of our national footprint as in some other countries, but nonetheless, we are looking to try and reduce our emissions. And that's a sector that has been targeted more closely in the 2021 plan, as you can see, where the reduction in emissions aimed for in 2019 was kind of roughly 10%. Now it's going up to about 30 or 40%. The agriculture sector is a particular challenge for Ireland. It does represent over 1/3 of our emissions. And that's in spite of the fact, I guess, that our emissions, or the intensity of emissions from like what you get for the 30% is relatively good at a global level by comparison, but nonetheless, it's 30% and it needs to be a lot less than that. So in the latest plan, we're aiming to reduce that by 20 or 30% by 2030. And then LULUCF, which relates to plans like afforestation, rewetting bogs, grassland management to reduce the emissions associated with these things. We're looking to reduce our emissions from that sector by 40 to 60% by 2030. So how is this being driven? So I guess what we've seen since the 2014 days of the national policy position is that it has evolved from one government department or ministry to the whole of government effort. And that is informed by a Climate Change Advisory Council, which is an independent board which proposes carbon budgets for the government to use in the climate action plans. The Climate Action Delivery Board sits within the department of our Prime Minister, our Taoiseach, and that holds every government department responsible for delivery on the actions that are going to achieve the emission reductions we had on the last slide. These climate action plans, their plan is that we would have them every year, and they include quarterly progress reports, which the delivery board will track how each department gets on in terms of achieving that. And if departments are not in compliance with that, they have to outline the corrective measures that will put them back on track. The extent of the changes that we're going to need to bring about to get to our 2030 and 2050 targets mean basically a reinvention of our society. And to make that work, we've put in place a huge just transition framework, and we're looking to take advantage of the decarbonisation opportunities that this presents. There's also a big piece in terms of public awareness and engagement around how that's going to work and where the sectors that are most impacted by the transitions we're trying to bring about are, and what we can do to plan ahead for that and work with it. And finally, I suppose the plan, it recognises the role of the public sector, and I think we'll hear more of that from Helen shortly, but I'll touch on it myself as well in terms of what role the public sector can play. So the public sector itself has a target to reduce its own carbon footprint by 51% by 2030. Previously we had an ambition of reducing our emissions, the energy efficiency to improve it by 33% in 2030, and now we need to improve that in 2020. And now we need to improve that by 50% by 2030. It recognizes that remote working is going to play a role in reducing our carbon footprint. It has a lot in it about sustainable mobility for the public sector to be exemplars on. We're going to electrify our national bus as part, I suppose, of the transport emission reductions measures we spoke about there. One of the things we're looking to do is to electrify our national bus fleet, and we're going to triple the electrification of Ireland's rail network by 2030. So where does the health sector come in this? As was, I think, as Jody touched on earlier, we have a health sector that has some of, what you'd call scope 1, the direct emissions. And if we look at them here, they'd be kind of the health sector's built environment. And Helen will probably be talking a bit more about that. The health sector will be the lead actor in relation to the likes of running a health service during the kinds of extreme weather that we're getting more of in Ireland now as we deal with the increasing impacts of climate change. And touching with that, I suppose, if you look at the increasing incidence of UV and skin cancer and associated, again, as we deal with climate change, that's an area where the health sector would lead on. Air pollution is something that is probably the most direct link between health and climate, where the air pollution is bad for climate change and it's bad for people's health. And there's a lot, I suppose, happening in the space of where you get kind of the co-benefits from both areas. And this has been one of the most highlighted issues, I think, at a global level. And it's certainly one of the main things I brought home from COP26. The other policy areas where health can take a lead, where you can see climate co-benefits, will be around active living, I suppose, an increase in walking and cycling and less use of the car. And then on the diet side of things, in terms of managing obesity and looking at more sustainable diets and increasing the amount of plant in the diet and the measures along those lines, where you can have climate co-benefits from that. And then beyond that, and I think particularly when you look at the ideas around the scope 2 and the scope 3, is what can the health sector do in terms of influencing and coordinating with other sectors where we can. I'm not going to get into too much detail about the carbon footprint of the health sector in Ireland. Like I said, I think Helen will speak in a little bit more detail on that, but I suppose at a high level, it represents about 18% of the public sector energy use. The health sector itself has reduced its, reduced its carbon footprint by 26% in terms of the energy use since 2009. and the Department of Health by 36% since 2009. Now, given that the Department of Health only has one building, and the building it has now is much more energy efficient than it was in 2009, that's kind of what that was. We have a bit of a breakdown there. I might just share these slides afterwards because I don't propose to talk in too much detail about where the emissions across the public sector are coming from, but you can see where the health sits there, that it's about 20% of what the total carbon footprint of the sector is. And then the sources of emissions across the different, where the savings are coming from across the health sector. So what's happening in the Department of Health? We've set up a climate change oversight group, and what this is going to do, this is going to interact with national structures for climate action. It's going to bring together that wide range of where health intersects with climate within the department and develop a coherent voice on the climate messaging in that space and a coherent development of policy in that space. It's going to be a platform for engaging with the broader health sector, like the HSE, the research community, the WHO, NGOs, and wider health sector. And it's also going to give a platform to review where we're at in terms of our action and scale it up. So far to date, the main thing that's happened in the health sector was there was a development of an adaptation plan in 2019, which was under that national adaptation framework structure I mentioned earlier. And that set out a range of actions across 6 areas, which were leadership, severe weather events, UV impacts, air pollution, and then monitoring, research, and evaluation. Now, shortly after that plan came out, COVID hit. So to a certain extent, we've picked it up since the summer when we set up our climate change unit, and we're looking at how we take that forward. And I suppose the key actions we've had, like I said, we set up the oversight group. We're identifying where the responsibilities for climate action rest across different policy areas. We're looking at how climate is analysed and dealt with by the different bodies under the aegis of the department. And Helen will speak to the HSE, which is by a significant margin the most significant, the main one of those, but there are 16 others. So we're engaging with them as well. Then we're looking to map the interactions between health and climate policies, and that'll form the basis for how we build on what was identified in 2019 and subsequently when mitigation became part of the health sector's challenge as well. So our next steps then, we're going to take a look at those commitments, look at what actions have taken place on them and what we can do now. We're going to look at what the climate action plan has in terms of new actions or new policy areas and how we can work with other government departments and agencies to push the climate agenda forward. We're developing a more coherent set of a health, if you like, a health sector climate agenda and how we're going to drive action forward on that. We're going to need to set out new actions, new milestones, and what resourcing or data needs we'll need if we're going to be able to achieve them. And finally, one of the big ones, and I think it kind of touches on the fact that we have this talk here today, is the role of communications around climate and health. This is a huge issue, and it's one of, like, I suppose, particularly with my global climate past, it's one surprisingly underdeveloped area, and it's one that I think we really need to take forward as a group. So I'm very much looking forward to hearing, I suppose, what Helen has to say in terms of what the HSE is doing, and then particularly around that space of how do we build that space more. So thanks, that's me.
That's great. Thanks a million, Colin. So we're hopefully going to hear from Helen now. You're going to share your own slides, Helen.
Okay.
And see how we get on.
Okay. Can you see my slides now?
Not at the moment.
Okay, just give me a second now.
Yeah.
Okay.
Yeah, I think we're being
Great.
just waiting for them. Yeah, there you are there.
Okay. Okay, great. Yeah, I'm very much looking forward to hearing what I have to say too, considering the IT issues I've had this morning. Yeah, it's not a normal day in the office if you don't have IT issues at this stage. I'm just going to run the slideshow. Okay, so my name is Helen Maher. I work in the HSE Estates function, the engineering function, if you like, of the HSE. We have a climate action and sustainability office. It's kind of hard to summarize what we were doing in 13 minutes or less. So a lot of it is on our website. So I would, refer everybody to have a look at our website afterwards if you want any extra information. Because I'm going to skim over some of the slides and hopefully they can be shared with you afterwards. Really, our office was set up and we kind of tackled climate change and sustainability in the health service through 7 different pillars. Climate change, energy efficiency, obviously, water conservation, waste prevention, sustainable transport, green procurement, and designing for the built environment, which would be the area that estates, I suppose, would be most comfortable with as engineers. So that's they're the 7 key areas that we work on in the HSE. The whole reason why our office was set up, it was set up in 2013. It was in response to HSE staff. Our Director General put out a survey asking staff how they wanted to make the health service more efficient. And one of the big themes that came across was the whole area of sustainability. So we looked at that and took that as our cue to set up what was known at the time as the National Sustainability Office, looking at the areas that staff had identified as ways of making the health service more efficient in a sustainable way. And you can see what's coming out there. Energy was very high on the agenda at the time, and other topics that were important to staff. And that's what we do on a day-to-day basis. We help staff in their location, wherever they're based, to make their health service, their location more sustainable through our office. Currently, to bring that up to date, we had a name change, so we're now the Climate Action and Sustainability Office. Thankfully, we report directly to Dean Sullivan, who's the Chief Strategy Officer for the HSE. We report therefore on a regular basis to the HSE board in terms of what we're doing. Obviously, our main task is to respond to the legislation, the Climate Action Plan and the legislation that came out. Up until now, our targets have been with regard to energy efficiency in terms of making allowances for activity that we have within the health service, which has greatly increased since we started monitoring our energy. But for future targets, they're going to be absolute. So they're based, we don't get an allowance in future in terms of increased levels of service activity across the health service. So that's a huge challenge. And also we have to bring our buildings, all of our buildings as public sector buildings, up to B standard in terms of energy rating, which is considerable considering that here in St. Finbar, some of the buildings where I'm located go back to the famine times. And obviously our ultimate aim is for the health service as a public sector body to be carbon neutral by 2050. So how are we structured? Well, our national lead is Peter Smith, and we have kind of 3 core units under the Climate Action and Sustainability Office. Kevin Sheridan leads out on climate action. Michael Query, who's actually trained as a doctor originally, he leads out on the climate change infrastructural resilience aspect of our work and would have tied in with the department in terms of the adaptation planning, etc. for the HSE. And I lead out on the other stuff, I suppose, that comes under in terms of sustainability, primarily our green healthcare programme. So yeah, how are we doing so far? Well, like Colin mentioned, we have been making progress. Our target for 2020 was a 33% reduction in energy use. We got to 26% by 2019. I think the 2020 figures haven't been published yet. And that was in the context, again, of making allowances for a 16% increase in service activity over that period. So, you know, I don't think at this stage we're going to meet our 33% energy target, but regardless of that, the new targets are more challenging anyway. And as I say, they don't make allowances for increases in service activity. Thankfully now, I would have to say that the climate action, that whole area is much better resourced this year and last year in terms of we have regional energy bureaus, like energy offices that we have established around the country. It's funded in partnership with SEAI. We offer 13 energy officers nationwide. So no matter where anyone contacts us from around the HSE, no matter where they're based, I have a local energy officer that I can refer them to help them make their HSE place of work more energy efficient. We generally try and get acute hospitals and our larger energy users to set up green teams so that we can work on an ongoing and continuous basis with the acute hospital. Of the locations that we've targeted, only 60% have got a currently established green team. So we're constantly petitioning our top users, the acute hospitals and the non-acute locations that generate the most amount of energy, to set themselves up in terms of a green team, and we can work best with locations in that respect. Then we can channel all our supports through those green teams, like training, funding for energy projects and that kind of thing. So through the green teams and the energy offices, we provide energy management advice. We help them set up their teams, energy teams. We do behavioural change programs, particularly with the OPW, in terms of, just simple changes that can be made to reduce energy consumption in any particular location. We do project identification, so we find projects that we can fund with a good payback period in terms of energy consumption. We fund those projects jointly with SEI with a big focus on carbon reduction, and we also provide lots of energy efficient design training, so that if there's any new build projects going on in any location, they're all designed through the spectrum of energy efficiency and zero carbon effectively. Can I just move this on now? So to give you an example of the sort of non-technical training that we would provide, for green teams, we have a carbon basics course that we get access through SEAI. It's a 3-hour course. Ideally, the target audience would be a green team, an energy team, or we have an engaging people awareness training, whereby it's more on the behavioural change side of things, where you're trying to influence health service staffs in terms of their behaviour to reduce energy efficiency. The scale of the challenge is immense in terms of the number of facilities that we have nationwide, over 2,500 facilities, some, as I say, dating back to famine times. Originally, we have an existing building stock. We have our annual energy spend is in the area of 65 million. We target 133 top users as representing 75% of our total energy consumption in the HSE in terms of targeting our resources. But we work with acute and community healthcare facilities across the country. And again, we influence the refurbishment of all healthcare buildings when it comes to that stage to have a B standard minimum. And then we fund new capital projects, new developments that you would hear about, let's say, high profile developments in terms of new buildings. We would also fund them to zero carbon. There's a lot of legislation involved in terms of if you're building a new healthcare building as a public building, whether it be a primary care centre or a health centre or a hospital, there's about 44 separate pieces of legislation that we comply with. So we've written our own guidance for project managers, for clinical staff that are involved in developing new buildings, to make sure that they're aware in a non-technical sort of format, the type of legal obligations that every healthcare building as a public sector building would have to comply with. So we wrote our own guidance on that. Recently, I was involved with a survey that Cork University Hospital carried out with regard to what's the public perception of what we're doing. CUH was the first hospital in Ireland to get accredited as a green campus flag, and they've got their third accreditation just there recently. So we asked post-COVID members of the public to tell us what was important, and was healthcare sustainability important in terms of what CUH were doing. And post-COVID, sort of their highlights, I suppose, what they highlighted was slightly different. It was a lot about waste management, single-use plastic that we're using now as a result of COVID, accessing the hospitals and healthy transport, public transport ways, not necessarily using public transport, it had to be said. But it was interesting to see where the focus is for members of the public in terms of what CUH were doing. So I'll start with green procurement. There's new guidance that has been published by the EPA in terms of procurement of products and services that we use here in the health service. Now, the 10 key categories that we're supposed to focus on in terms of green public procurement, which will become mandatory by 2023, they're all procured for us by the Office of Government Procurement. So, we're trying to get that message out to HSE staff that if they're ever involved in procurement of these types of products, that they really need to be asking the questions in terms of green public procurement criteria being associated with the frameworks. And we're trying to get as many public sector HSE procurement officers trained in that regard. So this is where we would enter into the scope 3 area as defined by the NHS in terms of the supply chain of the HSE. Just move that along, sorry. With regard to water conservation, we started up a program in about 2015 with the EPA to look at the whole area of water conservation. One of the less high profile utilities, I would describe them as, but we've developed a whole load of guidance that is Irish healthcare specific. So the guidance that we've based on audits of hospitals, both acute and non-acute, CNUs, all different types of healthcare facilities. It's a huge area because Irish Water, we're Irish Water's second largest customer, and obviously, as well as anything to do with energy, we can't run hospitals without clean supply of water. So there's a whole area there of work that we've done that we would again channel through our green teams. With regard to waste management, the COVID pandemic obviously highlighted a whole crisis, I would say, in terms of last January, we had healthcare risk waste building up in a lot of our acute hospitals. And that's something that we're hoping to avoid this winter. There's a lot of hospitals that they can do for themselves. One of the main things that they can do is put in place the reusable biosystems, which are reusable containers instead of using single-use containers for healthcare risk waste, but generally providing training to clinical staff, it has to be said, in terms of the designation of healthcare risk waste. What is and isn't healthcare risk waste is based on a clinical decision, and generally trying to stop packaging and non-clinical waste ending up in the yellow waste stream. So again, we have appointed this year 5 regional sustainability officers to support all of the acute hospitals in terms of managing healthcare risk waste appropriately. It's a small volume of waste, relatively speaking, generated in most healthcare facilities, but it has a high cost and it travels the furthest. Some of our healthcare risk waste is actually exported to Belgium for hazardous waste incineration, but the majority of it is treated here in Ireland, and it's a closed loop system where it's treated by steam sterilisation and it goes for energy recovery after that, as well as looking at all the new targets that we have now with regard to circular economy and non-hazardous waste, and getting hospitals to up the ante really in terms of what they're doing for recycling waste and food waste and that kind of thing.
Helen, if you have 1 minute there left.
Perfect. I'm on this, I think, second last slide, so that's perfect. So I just wanted to highlight, I think it's very important for any healthcare location to have a long-term goal in terms of sustainability. So at the moment, acute teaching hospitals are eligible to apply for the Green Campus flag. So a lot of green teams can be set up in healthcare facilities, and they can, depending on COVID and cyber attacks and different things, the progress can kind of stall and move forward and that kind of thing. So it's very important, I think, for locations to have a long-term goal in terms of what are they ultimately trying to achieve. So you see here, for example, Cork University Hospital and Sligo are the 2 acute teaching hospitals in the country that are currently accredited for a Green Campus flag. And the National Maternity Hospital has an ISO 14001 environmental accreditation. So I would encourage all healthcare facilities to move towards some sort of long-term accreditation in terms of what they're doing for sustainability, because it's a very public thing to do, and it really means that you have the backing of the CEO. So I would be wondering, although I know there's a certain amount of things happening in St. James's and the South Infirmary, what is happening in the other hospitals that I've listed there? Some of them have green teams, some of them don't have them yet. So we're really trying to get all those hospitals to work towards an accreditation. So I suppose in summary, we work with lots of different staff, all different backgrounds. I've worked with a couple of doctors, particularly in CUH, CUMH. Some of them are IDE members. But I would really appeal to any doctors that are members of the IDE or the global network that, we really need doctors to get involved at an area that they're based or wherever they're based. If there isn't a green team set up in your location, help us to set up that green team, because certainly, CEOs of hospitals and senior managers have, obviously, they do listen quite carefully to clinical leaders in the health service. So we need to work with you really to help hospitals and locations set up green teams to work towards the long-term plan on a day-to-day basis in a very practical way. We've lots of supports available. We just need the leaders from a medical background or from whatever background to come forward and help us set up green teams in those locations. Okay, and thank you very much.
Thanks a million, Helen. We were due to hear from Aneza Grace today as well, who is a young climate activist from Rwanda, but unfortunately she couldn't make it. So we're going to move to our final speaker, Dr. Terry Kemper.
Hello, everybody. I'll just get the slides up. Okay. Hi, I'm Terry Kemper. I'm a retired GP in the southwest of England, in Bristol. And I'm talking about after COP26, what does healthcare need to do next, really? I'm illustrating this with some images which have been tweeted from COP26. So climate action, only drop it and go home is one of them. This just shows where we are at the moment regarding our carbon dioxide emission tons per capita. You can see Ireland on the right and the UK on the right. We've both reduced our emissions quite considerably, but clearly we've still got a long way to go. Now, after only 25 previous COPs, the argument has now been won at COP26 that something needs to be done. And now we just need to decide the what, the how, and perhaps the when. Because clearly the disasters are collaborating slightly better than we are at the moment. And this is a slide just to show where we are globally. Our current policies are taking us up to a 2.5 to 2.9 global warming by the end of the century. Our 2030 targets might bring that down to 2.4. An optimistic scenario brings us down to 1.8, but that's still above the 1.5 target that we have for the end of the century. And that optimistic 1.8 degree target includes China doing this. China's currently the largest emitter, and it's got to dramatically reduce its carbon emissions if we were going to reach that optimistic level of 1.8 global warming. So what's to be done? Well, a wise doctor once wrote this, which should make it very clear for everybody. But these problems aren't new, actually. These problems about what's to be done have gone back a long, long time. And just as an example, I wanted to quote this one from Lenin from 1902. He was grappling with the problem of his movement, and he wrote this paper, What's to be Done? It's a famous paper. He apologized at the start for the delay because he was trying to unite all the social democratic organizations abroad, and he wanted to wait until he'd done that. That attempt failed. But he summed up the situation by saying that the movement had been in three phases. And the first was the rise and consolidation of the theory and program of social democracy. And the second one was this sort of social movement, the upsurge of the masses, the Extinction Rebellions and the like as a political movement. And the third period is where he was stuck now, which is this period of disunity, dissolution, and vacillation. And his answer to what is to be done was really put an end to the third period of disunity, dissolution, and vacillation. So that's what we have to do. And the Climate Lancet Countdown summary, which we've heard about already, gives us a clear path that each country should pursue low carbon economic recovery pathways, implementing policies that reduce inequities and improve human health. We hear a lot about the low carbon economy, but we've also got to be reducing those inequities and improve human health all over. You know, unless everybody benefits, none of us will benefit. The Kate Ross donut economic model is also another illustration to improve planetary health. She gives this sort of clear model that for humanity to inhabit this safe and just space, we have to have a great social foundation where everybody is looked after, but at the same time not go beyond our natural ecological ceiling. And Bill Gates puts it in a slightly different way in his book: do everything you can now and innovate like crazy. So we know what needs to be done generally, but we're going to talk about health. So in health, we really need to develop these climate resilient, sustainable, low carbon health systems. And at COP26, the UK was the presidency, and it can introduce its sort of add-ons to COP26. COP26 isn't concerned about health at all, but each president can introduce things. So the UK had this sort of a health program, and it's got the support of all these various countries, including the USA and Germany. I'm not sure about if Ireland's formally signed up to this, but it's clearly on the same path. We've pledged to develop climate resilient, sustainable, low carbon health systems because, as we've heard, healthcare is responsible for almost 5% of the worldwide total greenhouse emissions. And whatever happens, we need to be adaptable for the changes which are going to be happening, because without any doubt, Ireland is going to get to have more frequent floods and worse floods, just like the UK. And we've got to be able to adapt to that. And generally, public opinion supports all this, but support falls a bit when it impacts any individual's treatment decisions and care, and perhaps that's not much of a surprise. I'm based in Bristol in the southwest, and we're currently just surveying GP trainees and their educators in the southwest of England. And there's about 1,500 in total, about 500 educators and about 1,000 GP trainees. And this is just, we're halfway through it really, and this is just the early responders. So they're probably not even representative of the entire population. But 70% report no learning or training about planetary health. 80% say they've had insufficient learning and training. And more than 50% aren't really aware of the three main resources that we provide for GPs about sustainability. And 25% weren't aware of any resources for general practice about sustainability. And this is the population, GPs in training or educating, and the first responders to the survey that you'd expect to know a little bit more than they do. So the reality for all of us is that we are in a bubble. The bubble is slightly bigger than it was 10 years ago, but it's still a pretty small bubble. And most of our colleagues and most of the population are outside of that bubble, and they're on their own psychological climate change journey. Most are up there at the top, on the top right, denial, skipped a slide somehow, and they're still in denial. And then gradually what will happen is they'll go on and they'll get an understanding of the true situation and start to get the worry and anger and fear that we've probably all felt. And skipping slides here, but anyway, then we go on to grief, where we have sadness about the loss of the natural world and worries for our children and grandchildren. And then eventually we get to this realization that somebody has to act, and it probably needs to be us. And that's where we get to the state of mind where we can actually do something sensible. We've accepted the situation, and we just have to get on and sort ourselves out. It's a much more professional approach to the whole problem, which I hope we're all going to get to. So this also is a tweet from the COP26 from somebody called Camille, who's a 13-year-old Lithuanian. Everything we do without action is worthless, or it's the Greta Thunberg blah, blah, blah approach. So why don't people act? Well, generally, most people do want to act, but they don't know what to do about it. And all the instructions are just too high level for anybody to actually know what to do. It's just too complicated and there's too much to do. So if you're not sure what rational action you should be taking, I direct you to this year's Sao Paulo Declaration, which was set out by the Planetary Health Alliance, and it really gives all sectors of society instructions about what they should be doing. The next slide just tells you what you should be doing in health. But you have to remember not to get overwhelmed, because although you can do anything, you certainly can't do everything. And we've already heard about this green teams and green communities. We need more green teams and more green communities working together rather than isolated green champions trying to do everything by themselves, because that just won't work. We're all going to need to be a lot more carbon literate to know our footprints at work and try to reduce it. Just yesterday in the UK, we introduced a new free GP carbon calculator for general practices, which is very easy to use. I tried using these about 5 or 6 years ago, and I gave up because they're far too complicated. This one is really easy to do. And then we all need to decide what we can do, what we will do. And just remember, there's always more to be done, but we have to stay focused on what we can do rather than the entirety of the problem, because it will just overwhelm us. This is the Sao Paulo Declaration, and this is just a page talking about health practitioners, health sector, and international organizations. But there's a page for everybody on it. So if you don't know what to do, you can look it up there. And just in last week's BMJ, this is a visual summary of what needs to be done in healthcare. But again, it's too high a level. If I'm working away in my hospital or healthcare institution or my general practice, this is too high level for me. I need to know, what can I do today? So that's why it's quite useful to have simple toolkits. And I'm just giving you the example of this one. We've already heard about green campus flags, which I'm sure are a bit like this in the hospitals in Ireland, but this can be adapted for use by any healthcare institution. So this was originally started by the National Union of Students in the UK around about 15 years ago, and started in universities and then spread through other organizations. But 7 years ago, we adapted it for general practice. And the idea was that if anybody asked, what can I do in my general practice, this would give you an answer. So now it's evolved into over 100 answers to the question, what can I do in my practice? And each one says, what you should be doing, and then also why you should be doing it, and then gives you tips on how to achieve it. And then also, if you're of that mind, you can get points for achieving it, turning it into a quality improvement cycle. And then you can get prizes for points because you're actually gradually getting better. And now this toolkit takes you all the way from the start, all the way through to becoming a net zero organization. And the advantage is, in addition to advising you what you can do, it saves you money, because if you consume waste and waste less, you're going to save money. And then it's also a very useful way of sharing work and delegating work throughout your organization, because it gives people clear tasks to do. And then you can spread the culture through the rest of the communities that you reach into. And this is just an example from the toolkit. Ignore the top line because this is a sort of a sample practice, but that will give you your individual practices achievement. The middle horizontal line is all the practices that are involved in this, and currently, this was last week, there are 1,091. There's over around about 1,120 this week, and it tells you all the practices that are there. And on the top right-hand side, on the right-hand side, there's a league table of the number of points the different practices have achieved. The bottom line is all the other organisations, hospitals, universities, and the like, in different countries, because it's not just UK, Australia, Holland are the other two main users of this thing. And of the organisations taking part, there is 1,000 GPs are just one organisation. So there's 198 other organisations, taking part in this toolkit. And the reason I'm mentioning this is really because don't go out and reinvent things that already exist. You've got to make this task dead easy. So if you are thinking in general practice, and in Ireland, you're welcome to use our UK toolkit. It's free, and a lot of it will be things which are useful for you. But for other organisations, for hospitals and things like that, you'll really need to work out, how you want to make your own progress. But the template is there; it already exists. And if you're interested in developing a toolkit that any individual in any of your organizations can use that makes sense to them, then it's a route that you can go on. So if you contact SOS.Earth, the International Students Organizing for Sustainability, they'll be able to help you. And our toolkit, they administer and run it for £10,000 a year. So it's pretty cheap, actually. So alongside all this, you also need relentless, stubborn optimism, and you need to avoid the environmental grief, the climate depression, the eco-anxiety, the utilitarianism, and the being a doomer that we see in people all around us. We need to avoid all of that. And at the same time, remember that missing out slides, yeah. Oh, having a living is about what you can get in life, but having a life is really about what you can give in life. So we need to start giving back and just start doing what we need to be doing in all our organizations so that we can make this big transformation from where we are now to this new world that's going to happen, whatever happens in the next 10, 20, 30 years. to give the next generation the best possible chance they have in the world that we've messed up for them. Okay, thank you.
Thanks a million, Terry. I think that was a lovely message to end the morning on. So we are going to move on to the Q&A now. So I have a couple of questions that have come in there. We might start with Helen. So Helen, I know you sort of did a little call out there at the end for any doctors who are listening to help set up green teams within their organizations. And I think something that from previous personal experience, I know that we have, just these temporary contracts. We move through sometimes 6 months or a year long, and it can be quite hard to get really involved there. We also have a question in from Rachel wondering, how can the HSE support the development of green teams in areas that don't have them already?
Yeah, I think, well, specifically on Rachel's point, yeah, we're here really, I suppose, to provide, if any location is interested in setting up a green team, i.e. if somebody is a member of staff for whatever period of time in any acute hospital, let's say as example, if they're interested in setting up a green team in that location, then we are here to help. We're here to provide members of the green teams in terms of technical advisory from the energy officer, sustainability officers. We're members of green teams all over the country. I'm here in COH. I'm a member of the green team in COH and CUMH. So we've been there, done that, bought the t-shirt. We know what works. We know what doesn't work. We know how to get your CEO on board to make a commitment to a long-term plan, so that even if green team members, for whatever reason, move on, move over, whatever, that the team itself as a unit is set up to have a long-term objective. And we basically provide the advice that allows the hospital or location to figure out for themselves what they want to take on first, because it can get overwhelming very quickly. So yeah, I mean, we're members of green teams nationwide. We can help anyone based in any HSE location to set up a green team in their location by providing the technical advice, and even helping them make the proposal that they'll have to present, let's say, to their CEO or to the lead consultant or whatever it is, to get them to buy into actually doing the sustainability initiative. The easier part will be once the green team is established. From my experience, I've found that it's very easy to find the champions in your location once the structures are put in place for people to actually work towards a green team.
Great, thanks, Helen. And there was also a question from John, just wondering if general practice teams can access the HSE Energy Office.
Yeah, I mean, our brief is HSE and HSE funded locations, and obviously our energy officers are focused, on a day-to-day basis in terms of the larger locations. But we help all healthcare staff, general practice or otherwise. We will help them make their location, their premises, their service more sustainable, environmentally friendly. Sometimes if I get requests, let's say even from outside the HSE, I'm able to point them towards resources that I would be aware of at local authority level. In terms of local authorities, all have energy officers, they all have sustainability officers as well. So, I can't guarantee that an energy officer would be able to call out to every general practice, to assess it at the same level of detail as we would for an acute hospital, but we can certainly provide the advice. We've lots of guidance on our website, local contacts that I can put them in touch with. So, I mean, we don't say no to anybody is what I would say. We help everybody that gets in contact with us.
That's great. We might move on to one for Colin then. So Colin, the climate action plan that came out, having a quick flick through it, there isn't really a leading role for health in it. Certain sectors, transport and agriculture, they've got their own kind of dedicated section in the plan, and even in the SDGs that they're listed, health is listed as one of the associated ones, but not one of the 5 key ones. So do you think that we need, a greater emphasis on health in our climate policy going forward?
I think there's 2 ways of looking at this. I think that from the point of view of people within the health sector looking at what can they do, there's we've seen from the example of the scope 1, scope 2, scope 3, and I think Terry has done a wonderful job of turning a global challenge into a series of nitty-gritty issues. And from the point of view within the sector, you can look at what can you do, and it can touch on, while you said, you're absolutely right, health isn't a leading role in this space at this stage, and I think globally health is a little bit behind the curve in terms of how it engages with this space, and that's not from an enthusiasm of the members of its community. So it is something we'll see how quickly that grows. But if you looked at, for example, what can I do about my my built environment if I'm working in the health sector, you've got as Helen touched on there, you've got what can the HSE do to help you? What can the local authorities do to help you? You've got a national retrofit program. If you want to look at, if we're shipping medical freight around the country, what can we do? You've got a program around the electrification of those vehicles. Like there's a lot being done that touches on the health sector without necessarily having health as a lead actor. And I think that's one of the challenges we're going to have to take this forward in terms of, like, to my mind, the real thing we need to start with is to map what those interactions look like and learn from the work that's done by the likes of the NHS in terms of, like, the way I'd see it is you'd have emissions where, like, that scope 1 space where the health sector itself is directly responsible for these emissions. Then you'll have emissions where health has a policy and it's kind of someone else's job to reduce the emissions, but the health argument can help that. And then you'll have issues where it's slightly broader again, where, like, if you look at, say, broader industrial emissions or issues around kind of shipping or whatever, you can kind of expand it out again and you can look at what can the health sector do here. So I agree. I think that this is the first climate plan that's mentioned health at all. And, if I have my way, there'll be plenty more mentions of health in the 2022 one. I like to give myself work to do. But like I said, I do think it's important to recognize that this is a cross-sectoral challenge. And one of the things we need to do is to make sure, as Helen said, and as Terry said, there are guidance out there, there are policies people can work on, and there's measures in place at a national level or whatever it is, if it's at an EU level or whatever, where there is help there is support there are grants there, whatever it is. And we need to make sure that there's an awareness of what those are, how they link up, and then ramp up how health can spread that message.
Yeah. Perfect. Just a comment from Dominic. I know you might have answered it in the chat box, but he was just wondering, or I suppose starting the conversation about, do you think there's a role for a healthcare professional to be on the Climate Change Advisory Council? And I guess as someone in the Department of Health, do you think you'll be able to push for that?
Yeah, I mean, I suppose, to be honest with you, this is something that I only really became aware of, the lacuna as is perceived in that area relatively recently. And my first, this is all my initial reaction and my initial thoughts on the issue. I do think there's a role for health as a consideration in terms of the types of advice that the CCAC can give. And I think that, like, I suppose because it's set up now on a statutory basis and its membership is assigned to the areas in the country where the main emissions programs are sitting, so that they have the expertise to guide that. Like I said, health is relatively new to the space, so I'm not entirely surprised there isn't a health member on the board yet, but it is something that I'd like to engage a bit more on, and at a time when it works and where, I wouldn't see any argument for why you wouldn't want a health member on the board. I'll put it that way.
Yeah, I think we had a suggested nominee back at the time, so you can always come back to us on that one. I might move on to Terry then. Terry, you've done a huge amount of work in the UK, particularly with the RCGP, I know, on sustainability, but just wondering if you have any advice for the HSE or the Department of Health on kind of where we go from here. We don't have the same sort of net zero plans at the moment. Where do you think we need to go next?
Well, I don't think any organisation should be having discussions without mentioning sustainability as part of it. It's a bit like we shouldn't be talking about having discussions without discussing diversity and equality. We also need to be thinking about sustainability, because although there is still a lot of relatively climate denialism, because people are just closing their minds to it because they don't really know what to do, it's all going to happen anyway. And so we are in the process of this great transformation in our society. 10 years from now, our world will look very different. We'll hopefully be electrified, and we'll all have had to make changes to get there. So really, sustainability in every conversation about every decision we make should be there. We should be pushing it into curriculum, absolutely everything. We should be thinking, what are the consequences of what we're doing today?
Yeah, that's a great point. We are, as IDE, we are actually doing some work on curriculum development for medical students. So yeah, I think you're right. It needs to be a part of every conversation. And then we might move to Jodie. Jodie, I really loved the point that you made about how pollution prevention should be the new patient safety campaign, because I think all of us working in acute hospitals are familiar with these posters and, you know, salads, the signs up about the drugs, everything. So if we can move to something like that, that sort of a campaign about pollution, it could be really effective. So that was a really interesting point. I know you were following the COP26 meetings and you were quite interested in what was going on. What do you think are the takeaways from COP for healthcare, or what are your thoughts on the climate pact?
Well, look, we've made a little bit of improvement in terms of commitments, but we're still on nearly 3-degree pathway, and so we really need to follow up with action. And it's great that so many healthcare systems are now signing on to or pledging to net zero, including the U.S. government, which is a big deal. That our Assistant Secretary of Health, Rachel Levine, has committed U.S. health sector to decarbonize, particularly the federally funded portion of our health system. And the U.S. is a quarter of global healthcare emissions. So that's all positive. The downside is that there are no targets, there are no timelines outside of what the NHS has done. I'm hearing what your national commitments are. What's unclear to me is, does that include healthcare itself? Because if we have those commitments to a target and a timeline, then it forces us to innovate and create the infrastructure, and that our green teams are not just, as I say, a merry band of volunteers, but integrated into every aspect of healthcare operations, from the CEO to our quality infrastructure to our procurement infrastructure. It has to be integrated in how we do every single aspect of operations. It's the health and all policies approach. In terms of COP, I would say that it's a little bit of a better commitment, but we need to follow up with action, with real action. So we need targets, we need timelines that are going to hold us accountable.
Yeah, absolutely. Yeah, and I guess you're kind of echoing what Terry said there, that it needs to be incorporated into every single conversation and every target across the government and in hospitals. We have another question for Colin from Mark. Just wondering if your unit has received increased resources, staffing, funding, or powers to lead on climate change adaptation within the health service.
Yeah, thanks.
Also, that's money, doesn't it?
I posted something in on that. If I could see, oh, there it is. At the hope of not contradicting my own answer within minutes of writing it. Where are we? Yeah, so I suppose what my take on this will be that it's a little bit more complex than just what can my unit go do and go out and make, build a thing or, introduce a new scheme or whatever it is. Like, the interactions between health and climate are kind of there already, in terms of, if you look at the built environment, if you look at, and okay, maybe not they're all there, but a lot of them are there, where if you look at the healthy living, the active travel, the diet, the built environment of the health sector, air pollution, like there are policy areas where health interacts with climate already. And what I want to do is to map that out and then look at how adequate is the ambition that's being shown by the health sector, where can we ramp that up? And then, like, to my mind, like, the staffing and the initial work program is in place. And I think it's premature at this stage to look at what resources would I need to push it forward, because I need that map. I need to see which of these policies needs to be pushed harder, or which new policies coming out of the climate action plan being driven by transport or enterprise or whoever it might be, where is there a hook for health to get in there and do more, and then go get the resources to make that happen. So, like I said, I suppose, the unit's only been in place since the summer. So that's kind of how I plan on taking it forward. If I can just add a quick word as well in relation to the last point about the outcomes of the COP. Just, I suppose, coming from my former role in terms of the EU team on the negotiation side of things, like, I agree that I suppose you look at the front page headlines the COP made over the last 3 weeks, and there was a tone to them, and appropriately so. But if you look at what we actually have at a global level, where we went from in 1992 saying there may be something up there we need to do something about, and from that to Kyoto, which said here's a list of countries who are doing some of these emissions, they need to do more, and then that failed for various competition reasons and George Bush. And then if you look at where it went from that, you actually, in 2015, we were bloody lucky, to be honest with you, to get a nexus of world leaders who would sign up, where they would all commit to set ambitious targets for their countries, report on those, and then scale them up over time. And even if you look at the conversation in 2015, which said 2 degrees, and then eventually, around 2010 or 12, it was 2 degrees. Then 1.5 came in, and then 1.5 became an ambition, and now 1.5 is the red line. And if you look at the fact that we've got up to a point now where we've finished the rule book, and that sounds incredibly unambitious, and it is a very blah, blah, blah document, but it is an incredibly important thing, because what that sets out is how every country is going to assure that they're all playing fair on this, how will they all work together to support this, and how they take it forward. Now, I think the main things that are coming out is that, as Terry said, we're into a conversation on action on, these commitments are all fine. I want to start seeing things happen. And that's the space the conversation needs to be in. But even now, if you think compared to 2015, the amount of countries that have set climate neutrality targets compared to that wasn't even on the table then. So I would be optimistic that we're into the space of action. And obviously one of the main failings that came out of COP26 was that the money and the support for everyone to do this, countries need to stand up and, recognize that they've been letting everyone down in that space. And that's where the next big thing is going to be. But I would have a certain perspective on it. I just wanted to put that out there. Thanks, Siv.
Yeah, absolutely. No, I know. And I guess it's hard. It's obviously frustrating in some ways, the document, but you do also have to take some positives from it. And the fact that next year the NDCs are going to be revisited a bit earlier, and there's going to be increased transparency. So we have to just keep going, I think, cross our fingers. Helen, a question that came in, and I suppose, Colin, this might relate to you as well, but we might go to Helen, is does the HSE have plan for a net zero commitment like the NHS?
Yeah, well, we already have a net zero target for 2050. So they are our new targets as a public sector body for 2050 is a net zero target. Now, at the moment, as far as I'm aware, that relates primarily to what we would call scope 1 and scope 2, which is the energy associated with the healthcare facilities that we use to run our healthcare facilities. The methodology to apply that to scope 3, which would be essentially our supply chain, where the NHS would have already gone. That methodology hasn't been developed, I think, at national level, i.e. at governmental level in Ireland. So they haven't decided how the public sector, never mind the HSE, are going to look at net zero for supply chain aspects. But in the meantime, we're working towards the green healthcare, the green public procurement guidance, which was published by the EPA this year, to target the 10 key categories of green public procurement, and to make sure that green criteria are included in those frameworks for 2023. And that's starting now. We're advising all healthcare staff that are involved in procurement to be asking the question about sustainability, about green public procurement, no matter what contract they're involved in. So yeah, the target has already been set for net zero for 2050 with regard to our buildings, and at national level, the methodology, I feel, is what's holding back a net zero target in terms of supply chain.
If I may just build on that, I would say that, being part of the team that evaluated the NHS approach and particularly developing the implementation strategy around scope 3, there actually is methodology that has been developed. We developed it with the NHS, essentially using economic input-output models for those areas where we don't know what the process-based emissions are. We do know them quite clearly for inhaled anesthetics and metered dose inhalers. Beyond that, we do use cost as a proxy, but it does take into the complex interactions throughout the hundreds of sectors in the economy until that time that manufacturers can be fully transparent on the emissions per product. And so, this is a recognized method, acceptable method as a proxy. The NHS has it. We used international procurement codes, so it can be replicated throughout the world. And bottom line is, if we know what we're spending our money on, all organizations are interested in saving money. So if we know what we're using as an organization, and even better, drilling down by specialty, by procedure, by condition, by provider, and understanding the variability between practices, we can identify better and ultimately best practices as we innovate and improve the materials that we use. But if there's wide variability between the performance of products and the performance of providers for conditions, there is opportunity for improvement there. But simply looking at how much stuff we're using and how much we're spending on it will also give the information that we need to get to the emissions. And this fits with the triple bottom line in terms of best care for the most patients at the least cost, even in the absence of specific environmental emissions information.
Thanks, Jodie.
Can I just say that the NHS has got about 70,000 different suppliers, and from April 2028, each supplier has to do carbon footprinting for every project that they supply to the NHS. So there's a direction of travel there, which will clearly benefit everybody.
Yeah. Just one last question that I don't know, either Jodie or Terry, you might want to take this, but how do the axis of equity and centering of vulnerable patients need to impact our policies and planning?
Well, I'm happy to start and say that we have to address the social determinants of health, and I'm coming from the U.S. perspective, obviously, and that means by bolstering economic opportunity, clean transportation, access to affordable healthcare, we are doing the right thing. And also by mitigating our emissions and mitigating our waste on the supply side, we are increasing the availability of those supplies for more people. So, and reducing the emissions in those communities that are most vulnerable. I think one of the challenges is when you think about COP and the need for elevation of the access and quality to care globally, universal healthcare, and particularly in low-income nations, that we can't really expect those nations to be mitigating their healthcare emissions at the same time that they need more supplies, they need continuous energy, they need more trained staff, and yet these are a lot of the nations that have signed on to commitments to net zero healthcare. So I would expect that those emissions have to rise. But the more that we increase access to quality care, which is the right thing to do, the more important it is for us to mitigate waste and mitigate emissions in high-income nations. We have to do more than our fair share as high-income nations.
It's clearly a huge problem, and you'll probably be aware that in parts of Scotland they set up this in primary care, this deep end practice. This idea it also exists in the Republic of Ireland as well, where certain areas have much more socially disadvantaged patients who basically die earlier and have worse health for longer before they die. And it's only by working together in these deep end practices and understanding the problems of the area and what can be done can you actually make improvements. So you have to understand the problem. And I'll just give you one example, which is that we know that in the UK we can expect, just like Ireland, more frequent and worse flooding events. But in the UK, 25% of all the people who are socially disadvantaged and live in flood-prone areas live in just 10 local authorities in the UK. So in a sense, we know this is going to happen. We know this huge number of people are going to be affected by this. We have to start acting now and do something about it. So there is a window of warning that we can actually do stuff to actually ameliorate and mitigate against the inevitable effects that are going to be happening. And at the same time, that will raise the level of healthcare for everybody else because we're just more aware of what's going on.
Yeah. Brilliant. Thank you very much, guys. I think it's the same as whenever we talk about the climate crisis, that it's affecting the people least responsible for it. And the same applies with the health outcomes as well. So yeah, improving healthcare access and quality, as Dr. Sherman said, ultimately benefits us all in the end and benefits the environment. So I think we're going to leave it at that, guys, because it's almost time. So if any of the speakers has anything, any last words they'd like to give. No, everyone's talked out at this point yet. So thank you very much to all of the speakers and to everyone who joined us today. If you have any questions that you didn't get a chance to get answered, send them on to us at info@globalhealth.ie. You'll also be able to find the recording of today's event on YouTube and on the Global Health website, which is globalhealth.ie. You can sign up to our IGHN newsletter there, and you can sign up to our Irish Doctors for the Environment newsletter at ide.ie. Our next event with the Irish Global Health Network will be on December 3rd, the annual Father Michael Kelly lecture, where we will be hearing from Winnie Byanyima, Director of the UN AIDS Programme. So hopefully we'll see you all there. And thanks again to everyone for joining us.